Let me express to Diane Gibson and the citizens of Dallas who rallied faithfully with their prayers during this crisis. I want to introduce the mother of Thomas, Duncan, who now lives in North Carolina, and the nephew, Josephus, who lives in North Carolina, who felt so distanced from any communication about what was happening to Thomas. So they did my radio program on Sunday morning. We cried out for help around the nation and began to get people to call the hospital to get information, to get access to doctors and nurses with some information. In part because of that national mobilization, help began to manifest itself. We hope that it is enough. Our nation has a long history with Liberia that must be part of this equation of our indebtedness to Liberia. Liberia is the creditor, not the debtor in this relationship. Americans were sent back to Africa to found Liberia. During World War II, the Voice of America was in Liberia. Roberts Field, American military base in Africa, was in Liberia. All the Firestone tires we drove down the roads came from the rubber plantations of Liberia. The most literate Africans for many years were from Liberia. It's been a nation with whom we shared partnership before there were the decolonization movements, before Ghana was free. The Francophone states, ultimately South Africa, Liberia and Ethiopia were the free countries, World War II, and these were our allies. And now they're in a state of need with a crippling disease. Well, this is not the first time that we've known contagious diseases. That was the SARS epidemic out of Asia some time back. The Merck contagious disease out of the Middle East. And there have been measles and smallpox and other contagious diseases. Now it is Ebola. They first found strands out of the Congo about 1976. With proper care, it can be healed and people can recover. We need, as Americans, to know it's critical, but we should not panic. Start running from and distancing ourselves from Africans. It is not the right thing to do. Thomas today needs love, yes, and medical treatment, and the same treatment afforded to others who are now in America facing this challenge. When he came to America, he came to get married, to be with his children. He showed no signs of the Ebola virus at that time. If he had, he would not have come home to be with his bride-to-be, nor with his children. He came to America. Someone in the village suggested there was a woman, a landlord's daughter, who was dying, who was pregnant. He helped take her to the hospital. She died. No one knew she had the Ebola, for example, nor did he have any signs of it. So when asked on the questionnaire, have you been around anyone with it? His answer was no, because he did not know that, no evidence of that. But then the issue is not the politics of the passport, it's the humanity of the medical treatment. That's what we're discussing. When you got sick, you went to the hospital. Poor, African without insurance, given a cursory examination, the signs of Ebola was evident from West Africa. It's most rampant right now in Liberia and Sierra Leone and Guinea. Without health insurance, was sent back into the community. The hospital sent Ebola back into the community. It did not give him the thorough exam he deserved. Maybe the fact that the southern states from Virginia around to Texas have rejected affordable care. The state has rejected $100 billion in Medicaid. There's no doubt there will be a better infrastructure for poor people all across the state of Texas, and indeed all across the South. It's strange to me the South will accept federal money for airports and highways and seaports and military bases, but not for medicine for the poor. They sent him back home. 2 days later, he came back deathly ill. And then the response was to isolate him, but not to give ZMAP, the medicine that worked. They said they couldn't find any more ZMAP. It's strange to me. We'd only have enough ZMAP for 2 patients in Georgia. Whatever treatment's been afforded those persons in Georgia and Nebraska, Thomas Duncan deserves the same treatment today, the same humane treatment today. So we have met with the mayor today, who I must say has been generous in his reach out since this has broken so big, found a home for Louise and the children, an undisclosed place. Since that time, has made himself available to the family. Rainbow Push helped to mobilize the money to get the family here from North Carolina. Josephus drove the nephew and the mother from North Carolina just this past weekend. We're going to meet with the doctors shortly to get an update medical report at the hospital and visit Thomas. Hopefully he can see and hear us so he cannot touch us. And then we're going to have a prayer vigil today at 5 o'clock in front of the hospital, and urging all churches and religious orders to join us in a consistent commitment to prayer and the prayer vigil. Lastly, for churches, this is not the first time people panic in the face of a contagious disease. In biblical times, you can hear the lepers saying, unclean, unclean, run from the lepers. And in the face of treating lepers so inhumanely, Jesus slept in the quarantine shelter of Simon the leper all night long to say, kill the disease, don't kill the person. That's all we're saying today. Let's kill Ebola and let's spare people. And that's our appeal. And I want to thank the people of Dallas who reached out with generosity and urge others to not be afraid. Let's be careful but not be afraid, and let's work on finding remedy. Questions? This is Josephus, who has been talking for the family. They asked me to help them as of last week, but this is the mother and this is his sister. Cousin? Huh? Son and his son.
Reverend
Yes, ma'am.
You talked about the scare because that's what you're seeing on social media, that people are talking about don't go to Africa, and you've seen issues with the schools in the area where people are actually going to school or going to work and being sent home. And so this message is very important that you're sending out about, it seems people feel there's an anti-Africa and anti-Black.
Well, there is that dimension, unfortunately. You know, first of all, there are 3 West African countries where it is mainly centered, Liberia and Sierra Leone and Guinea. Quarantine the disease, not the countries. Don't destroy their economies as we seek to destroy the disease. Africa is a vast place. You can get America and Europe and Argentina in Africa with some land space left. Africa is as close, now Senegal is as close to New York as LA is. That's Africa. Then there's Ghana, and then there's South Africa. So it is unfair to talk about, you know, quarantining a continent. If you quarantine the continent, you couldn't get the technology for your cell phones. It's just not fair. That's panicky talk. We should not be panicking. We should not be mean-spirited. This issue of Ebola can be cured. One good news is that in Liberia this past week, where there were 200 people in a hospital are in recovery because they had a medical infrastructure. And so far in America, we've not lost anyone. We had America's best medical treatment because we have a medical infrastructure. If it worked in Georgia and will work in Nebraska, will work in Dallas as well. All we're asking in this medical application is one set of rules.
Reverend Jackson, was there a particular outreach from this family to you to send a message not only to the medical community of this city, but to others as well about they're concerned about their loved ones. Speak to us about their outreach to you specifically, why they wanted your voice here.
Well, I've been going back and forth to Liberia since 1969 across the years. We know many people in Liberia. We know Liberia's asset to America. We know of Roberts Field, where American bases operated from in World War II. We know of where the Voice of America was in Liberia. We know of Firestone rubber plantations in Liberia. We know of some Americans educated in Liberia. So there's a kinship across the years. But the mother and the nephew, the sister, the son, they couldn't get any information. There's more focus on treating him as a criminal than treating him as a patient.
Yeah.
Treating him as a criminal than a patient. Whatever the politics were at the border, once he got to the hospital, he should have been received as a patient the day he came to the hospital. He had all the signs, vomiting and high temperature and from West Africa, but he was poor in Africa and had no health insurance and was sent away. He came back and was in isolation but not getting the best of medical treatment. And we then began to cry out national mobilization. And now that there's been the lights on the situation here, now there's a rapid and thorough response. And that's a good thing, but it could have been done a week ago.
Reverend, with your comments being critical about the hospitals, you said they sent Ebola back into the community.
Well, he came to the hospital with the Ebola.
Right.
And the vomiting and the temperature and the signs. They examined him and didn't find Ebola, and Ebola was there. So they sent him back in the community with Ebola.
And are you going to share those concerns with the doctors when you're there later today?
We will, and of course we don't do so in anger. We do so in a concern that this matter is addressed thoroughly, and that he receive even now the best medical treatment, the most humane treatment America has to offer. It sends a terrible signal when there is two sets of rules. One's the rules for Georgia, Nebraska, another for Dallas. That's inconsistent. We want fairness. We're asking people to offer their love, humane treatment, and the best of medicine.
Reverend Jackson, as it pertains to the United States not turning its back on Africa, have you had an opportunity to speak with any of the major airlines that are now advertising that they're not flying to Africa? Have you been able to address that issue?
No, but I hope that is not the case. I hope they will sell for screening. They should not shut down the economy of whole countries because there's a disease that can be isolated and cured.
Absolutely.
Those who have medical care are being cured. It's not an airborne disease so far as the medical science tells us today. So I hope that there will not be such an overreaction until we compound the crisis with panic. Again, we had the SARS disease coming out of Asia. We didn't try to shut down Asia or a given country. The MERS coming out of the Middle East. Measles and other diseases came out of Europe. That's not the way that this, smallpox. You isolate the disease and try to cure the patient.
Reverend Jackson, can we hear from the families?
I want you to hear from the spokesman from Josephus, and then we're going to hurry off, not out of any disrespect, but we have to meet with the doctors at the hospital now to get the medical update, and no doubt later that we can give you the results of their update, and we plan to see him to his in his isolated place and have prayer with and for him today, and urging ministers and those who will through faith for the members to meet us, begin to hold prayer vigils for Thomas Duncan until he recovers. Today at 5 o'clock we're going to have our first small prayer vigil at 5 o'clock outside the Presbyterian Hospital. Yes. Josephus, you got anything to say about it?
No, at this time.
So not at this time. We're going to the hospital now.